Hello, everyone. Thank you so much for joining us. Welcome to our first webinar hosted by the Department of Community Health and Social Medicine at the University of Global Health Equity. My name is Zahira. I'm an assistant professor here and also the Godly St. Gore Chair of the Department of Community Health and Social Medicine. Welcome again, Karibu, Murakaza Neza. We are delighted to be in community with you today. Our first webinar in this series is entitled Committed to Communities, Transforming Health Through Research, Practice, and Power. And I wanted to maybe spend a few minutes sharing a little bit about the full webinar series before coming back to today and then introducing you to our esteemed guests. This is specifically a skill building webinar series, and it's really our goal in each conversation is to take away new skills, new techniques, new approaches that can be applied in our work, in our community-based work. And sometimes, like today, the conversation will be about research, but other days it will be about advocacy or education, implementation, or community organizing in health. And so we're delighted to have you with us on this new journey for our department and for UGHE. Today's webinar episode specifically will include a deep dive into what's called community-based participatory research, or CBPR. And CBPR is really about having equitable relationships and crafting research that is not only valuable in the halls of academia, but valuable in the real world, right? Where implementation and impact is important. And so we're delighted to have really two great guests who are going to help us understand how they've implemented community-based participatory research in their own context. You'll hear how they authentically utilize CBPR in their work with populations that may have been pushed to the margins. You'll hear about how they co-created work in ways that may be different than research you've heard from in the past. And so now I am so excited to introduce to you our panelists who are going to walk us through their experiences in two very different contexts and help us understand how you use community-based participatory approaches to answering really significant questions. Our first speaker is Dr. Sophie Johanni. And Dr. Sophie is an associate professor of counseling psychology at the University of Alberta. Her research focuses on mental health and psychosocial adaptation. Sophie has over 20 years of clinical work experience in private practice and also in community-based work with refugees and immigrant communities. So please join me in welcoming Dr. Sophie to this discussion. Welcome, welcome. Our second speaker is Nosifo Makake, and Nosifo is a PhD candidate in health promotion in the Department of Psychology at the University of KwaZulu-Natal in South Africa. And Nosifo's doctoral research engages female sex workers as peer educators in designing community-based interventions to address the challenges around the uptake of oral pre-exposure prophylaxis, or PrEP, for HIV prevention. Nosifo is also a lecturer within the Department of Health Promotion at the University of KwaZulu-Natal. Please join me in welcoming Nosifo to this conversation. Dr. Sophie, Nosifo, welcome, welcome. Thank you so much for joining us. So we want to take a moment to get us started and understand in our first conversation a little bit about each project that these two extraordinary women are working on. And then we'll walk through a process of understanding more about how they co-created their work and more about the actions that were taken as a result of their findings. I'm so delighted to see how many folks have joined us today, and I want to do a little bit of housekeeping before I jump into the first question for Dr. Sophie. So please feel free to ask us questions at any time during the conversation. The Q&A chat is open. In fact, we encourage you to ask them as they come to your mind so that when it's time for Q&A, we have a number of questions to pull from. So please feel free to engage in the chat in that way. Please also note that this conversation is being recorded. And so after this conversation, you will receive a recording. And with that said, we are going to jump right in. So thank you again so much for joining us today. So I'd like to get us started on this conversation about CBPR by asking Dr. Sophie to describe her recent community-based participatory research partnership with Syrian refugees who reside in Edmonton, Canada. And Sophie, we'd love to hear from you to tell us a little bit about this project and its purpose.
Okay. Thank you, Dr. Zahera, and members of the Department of Community Health and Social Medicine at the University of Global Health. It's a real pleasure to be with you in this capacity today. And I send you and participants greetings from Edmonton in Canada, which is also located in Territory 6, the traditional lands of First Nations and Métis people in this part of Canada. So my current research seeks a more complex understanding of refugee psychosocial adaptation and integration in resettlement countries after mass violence and trauma. And my projects do use community-based participatory approaches grounded in principles of collaboration, relationality, and the co-creation of knowledge to articulate the lived experiences of refugees while empowering them to lead their healing and integration projects. I'm currently leading a project funded by the Social Science and Humanities Research Council of Canada that focuses on both understanding and supporting the psychosocial adaptation of Syrian communities who began arriving in Canada in December of 2015. The project activities, which commenced in January of 2019, is a collaboration between a community-based organization in Edmonton called the Multicultural Health Brokers Cooperative, and I'll just refer to them as my community partner from now on, the University of Alberta, members of the Syrian community in Edmonton, and a collaborator from the University of Bath Spa in the UK. Our objectives are to examine the psychosocial adaptation needs and challenges of different Syrian refugee groups, to understand the processes involved in developing and implementing community learning empowerment groups, and to mobilize knowledge generated through the development of a resource to be used by Syrians as well as other refugee groups. So aligned with the community-based participatory research approach, the research objectives were co-created with our community partner, with whom we've been working together on Syrian-related issues since 2015. And this research actually builds on two smaller projects that allowed us to develop an understanding of some of the early challenges faced by families and begin to establish relationships with members of the Syrian community that co-developed the current project. Our current team includes 7 natural leaders and 2 cultural brokers from the Syrian community, 1 Arabic-speaking community coordinator. And just as an aside, culture brokers, you'll hear me talking about them. Culture brokers, in our context here, are bicultural individuals who share the language and culture of the families or communities they serve. And they bridge between systems and groups to increase understanding, reduce tensions that can arise from sociocultural misunderstandings, and address invisible power disparities. Our partner organization specializes in culture brokering with over 90 trained culture brokers serving more than 30 linguistic and ethnic groups in our city. So our team consists of 4 academics, 2 representatives from the partner organization, 9 natural community leaders, 4 graduate students, and currently over 60 community members who are participants. Our project uses a train-the-trainer model, whereby 7 natural leaders supported by culture brokers facilitate community learning for empowerment groups, where community members engage in dialogue on challenges, strengths, and needs, guided by 5 key topics relevant to psychosocial adaptation after trauma. Topics around safety, relationship and bonds, justice and human rights, sense of meaning and purpose in their lives, and the reestablishment of identity and roles. Our project consists of 3 phases, just as most projects would be. And our first phase included the development of the research team, including training the team in CBPR methods, trauma-informed practice, because we're working with individuals recently who recently experienced trauma, as well as group facilitation skills for the leaders. We also co-created the modules used to run groups and guide facilitation. Early on also, we held a stakeholder engagement session at the beginning of the project where leaders and some of the community members had a chance to meet with local stakeholders, including personnel from the local municipal government. In the second phase, this involved the actual running of 7 groups facilitated by 7 leaders and culture brokers. These groups reflected the diversity of the leaders and the Syrian community members, who included Assyrian, Kurdish, Christian, Muslims, men, women, seniors, and youth. Each leader ran 6 sessions, and in between each session, the research team met with the leaders for focus group discussions centered on the learnings and content, as well as general facilitation of the groups. The third phase includes in-depth data analysis of group dialogue and focus group discussions, recordings, as well as knowledge mobilization activities. Unfortunately, the pandemic has slowed down our work as Canada went into lockdown just as we were winding up the second phase of the project. So we're currently exploring ways of including community members in the data analysis process, which is underway, while also maintaining social distance. Thank you, Zahira. Stop for now.
Excellent. Thank you so much. And I know it's hard to describe all of that in a short period of time, but really appreciative and love that you're highlighting all the different roles that members of the Syrian community are playing, whether as brokers or leading all of these different groups. So we look forward to learning more on that. A note for the audience, just so you know, a lot of this journey that we're sharing with you is about the creation of CBPR. So you'll hear a little bit about the findings ultimately, but so much of this webinar is about learning how to do the different steps of the work. So keep your questions coming and we will address those as we move through towards the end of the conversation. So Dr. Sophie, thank you so much again for sharing a bit about how this work got started and all the many different ways that you've crafted partnerships. We're going to come back to that conversation about co-creation in a moment. But I'd love to now invite Nosifo to join us. And may you please do the same. Describe a bit about the study for us. Tell us a bit about the community of female sex workers that you've partnered with in Durban, and talk us through that journey a bit.
Thank you so much, Zahira, for having me on this webinar. And greetings to your colleagues at the University of Global Health Equity, and also greetings to our viewers who've joined us today. So my research that I conducted was towards my PhD study. And it was basically research that was conducted with female sex workers, looking at the accessibility and acceptability of oral pre-exposure prophylaxis for HIV prevention in Durban, South Africa. Furthermore, this research resulted in the development of an intervention plan to address challenges with PrEP uptake among sex workers. To provide a brief background for the purposes of our listeners, PrEP, which is an ARV for HIV prevention, was introduced in South Africa in June 2016 among sex workers through selected distribution sites. However, when PrEP distribution started, uptake and retention proved to be very low. I will just quote a few statistics from about 2 studies. With one study showed that the initial uptake of PrEP in the areas where the studies was conducted was Johannesburg and Pretoria. 98% of sex workers were initiated, but after 12 months, only 22% were retained on PrEP. And another study showed that 66% of sex workers were offered PrEP, but only 13% were initiated. So this study that I conducted was in 2 phases. Phase 1 was a situational analysis to actually understand the barriers and facilitators of PrEP use among sex workers. And the second phase was a PrEP intervention plan, which we co-created with sex worker peer educators to respond to these challenges to PrEP uptake. And in doing this work, it was important for me to engage with the sex work organization on the ground, because sex workers are very organized in this context. So there's a sex work organization that is functional in the 9 provinces in South Africa. And it was also important for me as well to engage with the research organization that was providing PrEP to sex workers on the ground. And both these organizations work with peer educators. So peer education is the vehicle that these organizations utilize for HIV prevention amongst sex workers. So peer educators conduct outreach, They conduct PrEP education and awareness, and also many other services that are geared towards HIV prevention among sex workers in this context.
Excellent. Thank you so much, Nosifo. And a reminder to everyone on hopefully this beginning of the conversation where you're hearing about the different kinds of work in two very different contexts with two very different communities is of interest to you and is creating some questions in your mind. So please feel free to share them now and get that started in our Q&A, and we'll be sure to answer them as we move along. But I'm really grateful thus far to what Sophie and Nosifo have shared, particularly around the role that members of the community play in the research. And so, we'll continue to highlight that in the different ways that they have played, and whether it's crafting the research, designing the questions, designing research questions, thinking about how to craft tools together, and even an analysis. And that's a really key point that we want to drive home today in relationship to CBPR. And so we're going to transition a little bit now that you've heard a bit about these two projects, working with Syrian refugees in Canada on issues of mental health and psychosocial adaptation, and working with sex workers in Durban on access to PrEP for HIV prevention. And we want to now start digging deep on both of their studies in this aspect of co-creation. How do you build this work in true partnership? And not just, discussing that there's a partnership, but authentically being able to do that and to drive home equity in the midst of your research. And so I'd love to dig a little bit deeper on each study and maybe ask both Dr. Sophie and Nosifo to share how you co-created these projects with affected communities so early in the process of research development. And I think you've noted a little bit about some of the ways that that's happened, and now we'd love to dive deeply into how that co-creation takes place. And maybe we'll start this time with Nosifo and then followed by Dr. Sophie. I think you're muted.
Apologies for that. So Zahira, the process of co-creation involved building relationships on the ground, really taking the time to connect with stakeholders, like I mentioned, the sex work organization, as well as the research organization. And this was very, very important for me. And as a result, I dedicated about 2 years of my PhD process to this process of community engagement and really building these relationships. And the research, like I mentioned, was conducted in 2 phases. And for the situational analysis phase and really trying to understand what the problems are, I made it clear to peer educators that, their involvement would be very important from the beginning, and I would need their guidance with regards to, developing the interview guide, which the peers were very gracious and they were very happy to help me formulate this interview guide. And, they went as far as actually willing to be interviewees and to sort of pilot the guide with them. And they also suggested that I interview a variety of female sex workers, involve female sex workers who are on PrEP, obviously, but also extend the conversation to female sex workers who are not on PrEP, so as to get multiple perspectives. And also, this first group of peers then helped to connect me with the research organization that is distributing PrEP. And that organization also has peer educators. And so I went about interviewing the peer educators from the research organization as well. And something incredible actually happened where one of the peers, volunteered to be a research assistant. So she would, she gave off her time, she took me to the different places where sex workers work and where they live. And really, she was such a great sounding board. She was such a great resource in the sense that, her and I would have conversations about how to approach the interviews. We would actually have debriefing sessions. And she was just really guiding me and advising me throughout this process. And so that was the problem analysis phase. And the second phase was the intervention planning phase. In this phase, we had a group of 8 peer educators which formed part of the working group. And these are peer educators that were from the sex work organization and the research organization. But prior to the intervention planning, we had a data feedback meeting where, we sat down and we went through the data that was collected during the situational analysis phase, just to sort of look at the analysis and understand what these challenges were. And it was during that data feedback meeting then that the peers, were very willing to volunteer their time to form part of this working group. And that's when the intervention planning started. And what was interesting was that, this process afforded these 2 groups of peer educators an opportunity to synchronize their approach to PrEP education and promotion, which was initially fragmented because they were working as 2 separate groups. And furthermore, the peer educators took the lead in the intervention logistics. So they were the ones who decided when we would meet, where we would meet. They also started a WhatsApp group to facilitate easy communication. They even went as far as actually deciding the type of refreshments that they would prefer after each meeting. And it was important for me that the peers form part of this decision-making process at the very beginning, so as to foster the sense of collaboration and ownership. No decision was too big or too small for the peers to make. And my prolonged engagement with this community made me realize that the peer educators are such a great asset in the sex work community. They are enthusiastic, they are passionate, they are very knowledgeable about the needs of sex workers because they are sex workers themselves. So it was very important for me to actually have a good understanding of how, what the work of the peers was on the ground. And so involving them and working with them became very easy from that perspective. Thank you.
Excellent, thank you. I mean, that is a really marvelous description of how you do this collaborative work. And I love you said they started a WhatsApp group, they figured out what the refreshments should be at the meetings, all the way up to the scientific decisions about what kinds of questions get asked, where do you go to find the right people. I think that navigation that it sounds like that was provided in this partnership is so important. And we'll hear from Dr. Sophie in a moment in relationship to her co-creation experience. But part of the reason we've crafted this webinar today, but also the series, is because we think a lot about power and control in research. And I think what Nosifo outlined is really a shift and a change in who has power and who has control when we decide to research a question in a particular community. So thank you so much for that. Dr. Sophie, let's hear a little bit about your experience as well.
Yes, as Nosifo was talking and she said it took about 2 years to get, I thought, oh, maybe 2 years is the magic number, because similar to Nosifo, probably it was about a 2-year process before we actually started this particular project. So recall in my introduction that my colleagues and I have had a long-standing relationship with our partner organization. And I've also worked with refugees from various countries. In this instance, though, what was new is working with a brand new community, Syrians who just arrived in Canada. So remember, the project is born out of 2 smaller projects. And let me just share you a little bit with that, because you can see how one builds on the other and also helps to initiate those relationships that form the foundation of the work that we're doing. So prior to the arrival of Syrians, I'd actually began working with a team of Arabic-speaking community workers or brokers, preparing them to support Syrian families once they arrived in our city. So in 2016, while working with this team, with this group, we were able to receive a grant with our community partner to actually begin to examine the psychosocial needs of Syrian families with young children during that first year of settlement. And but this case, it was just from the perspective of the Arabic-speaking community workers. The findings at that time suggested that the families struggled with feeling safe and secure in Canada, adjusting to just the changes, including family roles, and just trying to find meaning in their lives as they settled in a new country after war. These observations reflected, from my point of view, many of the ecological systems frameworks of understanding refugee adaptation, particularly the key psychosocial needs identified in one of the models that I've used in the past, Derek Silove's adaptation and development after persecution and trauma module. The second project, which happened a year later, came out of an observation from our local health services, where they wondered why at the end of the first year of arrival, very few Syrians had accessed their mental health supports. Some Syrians who were present at the meeting with the health services at that time noted that a community approach may be more relevant to them and their particular experiences and cultural perspectives. So given findings from the first project with our Arabic-speaking brokers, my community partner approached me again to work with them and members of the Syrian community to begin to explore the potential relevance of a psychosocial approach to address mental health concerns. And this led to a mental health project with 10 Syrian community natural leaders exploring culturally sensitive and safe approaches to initiating conversations about well-being. And this is actually how we co-created and piloted the community dialogue method that is actually used in the current project. So we simply explored and built that together during that time. So you can see that there was a natural progression from one project to the next, where community members, our partner organization, and I would say academics were learning together about the challenges and also shaping the project design that led to the current study. And also you will see that our current design of the project allows ongoing co-creation and shared decision-making through the project itself. Very similar to NOCIFO, our community partners and the leaders who we work with very much kind of guide many of the decisions that happen and how decisions are made almost on a daily basis. So in the first phase, we co-created the curriculum for running the groups. While I was doing some training and group facilitation, we also did some training around trauma-informed practices. It was very much their own reflections and how they were kind of making that relevant to their own experience as well as their own cultural context. For example, reflecting on key terms. What does mental health mean in our perspective? How do we translate and think about things like justice, human rights, safety, trauma in Arabic and the Syrian culture perspective? Leaders also reflected on their own experiences to help guide the process. In the second phase, while they were running the groups, we had to actually refine the questions and the flow of questions once they started working with the groups and getting feedback from the groups themselves. So for example, we had to make sure that we changed the flow of questions to better support the group sharing that was happening. Also, for example, at one point, we shifted to using more visuals to guide the conversation. I would also share that this is not necessarily an easy process, in that in our case, language and translation process has been challenging in that we're working in Arabic, in English, and in Kurdish. So working with the culture brokers has been really valuable in this process, and that we were able to, through this process, actually co-develop an evaluation tool to use after each group session. I would also say that the collaborative decision-making happens even with individual group leaders and individual group members during the project. And I want to share a quick example here where 1 week before we were about to run one of the groups that consisted mainly of Kurdish women, there was actually an outbreak of fighting in northern Syria where many of the families had actually family members there. So I got a phone call from the cultural broker to discuss whether we should actually proceed given the potential for traumatization of group members. And of course, as the leader in the project, I have to be aware of ethics and care and concern for participants. We met with the leader and had a similar conversation. And the leader said, let me contact each of the group members and ask them what they think. So she contacted them and got back to me by the end of the day and said, each and every one of the women said, absolutely, we want to meet on Saturday. And I want to share that actually that ended up being one of the most poignant and powerful meetings that we had. And you know, despite us being present and available to provide support as needed, we didn't need to do that. It seemed to be just important to be there to witness and support the conversation. And I would say perhaps that the lesson here was the researcher learning to step aside and trust the strength and wisdom of the group members to guide the process in this case. So I would say that it takes time, and it's also been a construction, a co-construction at the beginning and during the process. And this continues to the point that we're in right now.
Wonderful. Thank you so much, Dr. Sophie. Just so many similarities, I think, between the approach that you and NoCFO shared in your partnership with communities. And if I say this most honestly, I think within academia, we sometimes struggle with the humility that's required to follow, right? And so it's really lovely to hear you all describe a 2-year-long investment in relationship before you even say, oh, I think there's a research question we need to tackle. And I think both for students and for seasoned researchers that we have to learn how both the pieces of humility, but we also have to learn this building of relationship and trust. And that so much research that happens is this sort of drop in, I've never met you before, but I have a series of survey questions and interview guides and focus groups. And then thank you for this information. And then kind of extractive, and then using that data for something. And the way you all have invested in the partnerships that you've described is really marvelous. And the way you continue to learn from your partners. So I'm so grateful for hearing a little bit about that. I might actually have a little bit of a follow-up for you, Dr. Sophie. You used the term natural leader. I think that's right. And I was wondering if you could unmute yourself and then share with us what you mean by natural leader.
Yes, thanks for asking me to clarify that. So when we talk about working with leaders, we're not talking necessarily with elected officials or leaders within the community. These are individuals who are working sort of at the grassroots level, who are identified early on as being sort of naturally kind of having a network that they're working with. They're also already people who identify as being trustworthy and so this has been an important sort of component of this work as well. Some of them cross over into leadership positions where they might be officially elected or they might have other roles. But in this case, we're really working with individuals who early on, even in the settlement process, were identified by other settlement agencies as individuals who are stepping forward, already sort of mobilizing their communities to really support each other. And so they became important members to join this particular process and through an invitation.
Excellent, thank you, thank you. And thanks for that language, because I think we often contemplate who are the leaders in a community, and I love that term, natural leaders, so thank you for that. So to everyone who's listening and watching, thank you again thus far for your attention and for the questions that are coming in. Keep them coming. I see some interesting ones already, so I'm looking forward to that as we move into our third and final segment of the conversation. So the final component of CBPR that we wanted to highlight this evening is significantly different from traditional research in that there is clear need and call for action. For doing something, for responding to what's been found in the data, and not simply ending with the write-up or the publication or the summary of some form. And I think that's important in the way that our guests have highlighted their relationship, that it would be hard to end a relationship like this at just a summary of findings. And so they have moved their work towards action. And so maybe we'll hand back to Dr. Sophie. We'd love to hear a little bit more about your work with Syrian refugees in Canada and how that's resulted in several different actions or tools for these communities. And maybe you can describe them for us and what you think their impact has been thus far.
Yes, so as Dr. Zahara just mentioned, one of the main goals and perhaps most exciting and at times challenging aspect of CBPR is the engendering of social actions based on the research. I would also just want to kind of clarify that our project is underway, and of course things being slowed down a little bit by COVID. I'm not going to talk specifically about outcomes, and perhaps she'll invite me back and I can share that with you in the next few years. But recall that one of the objectives of our current project is to mobilize knowledge generated through the development of a resource manual to be used by Syrians and other refugee groups interested in a similar community-based approach to addressing mental health and community development. So our goal eventually is to have sort of a tangible outcome. And the process that we engaged in through the project, through the co-creation of these modules, studying how the groups are forming, getting feedback as we go along in terms of how this is working for the participants in the group, is informing us as we go along, and that will be something that we hope to produce eventually. So since we're still in the middle of the project, let me share some examples of what I would call micro level actions that have emerged while the project is underway, and what community members at this point are identifying as some of perhaps the personal benefits. Since our project uses this community learning for empowerment groups, we hope that through dialogue about their experiences, community members would actually identify and create community-based solutions to support their own adaptation and integration. And so some of the ways in which we see some of the groups actually starting to do this, again, as we're in the process, is one of the men's group and their leader. And this particular leader had actually worked with us in the pilot that led to this particular project. They have been working with the local municipal government, advocating for settlement resources in their part of the city because they struggle with transportation needs to actually access some of the services that are available in some of the centers. Recall we'd had an engagement, stakeholder engagement event at the beginning of the project. So this leader has actually continued to work with some of their contacts through that event as well as their own efforts. This leader has also been running computer literacy classes for members of their community. And he also started a youth group with our partner organization. And many of the youth are actually children of his group participants. And they're using a similar model used from this project. We have a seniors group. And very early on, the seniors identified language as a significant barrier to their social integration, and it exacerbated their feelings of isolation, loneliness, and grieving separation from their family members. These seniors, through the project, located an English language teacher for their group, and they've actually been having lessons outside of the project. This group actually has continued to meet via Zoom during the pandemic. And I would say they're one of the few senior groups that I know who are actually meeting by Zoom and continue to support each other and work, connect, even after we've completed the group discussions. The group of Kurdish women reflected on their challenges in their early months, and they started to mobilize themselves with a local settlement agency to receive alerts when there were other Kurdish families arriving from Syria, and they began to engage in outreach activities to support those families in their own settlement. So these are some of the ways in which members from the groups themselves are starting to mobilize while we're actually engaged in the project. At an individual level, with the capacity building that has been embedded in the project, I would say that 4 of the 7 leaders are now working in community positions involving settlement and integration with other refugee groups, as well as their own community. And one of the youth participants in our youth group runs his own homework club for youth. And finally, I would just say that one of our research assistants, who is also a trainee in the project and is Syrian, she developed recently and won a knowledge mobilization storytelling contest based on her experience in the project. And hopefully we'll be able to provide you with this example after this particular event. So you can see that there are a number of ways in which events, people are actually are sort of being empowered to actually come up with solutions that fit their needs at this time, as well as while we wait to work towards some more broad, I would say, actions after the project. I would also just like to say that the preliminary analysis from the evaluation of the groups themselves show that the main benefit for participants that people talk about has been just meeting to share their experiences in a safe environment. While the focus of the project has been on adaptation in Canada, many conversations included their experiences during the war in Syria and in neighboring countries. Most noted that they would not have these kind of conversations or been able to engage in these kind of difficult conversations without the supportive and structured space provided in the project. And I would say that this appears to be more personally valuable and personally empowering. I want to point out also that these kind of conversations themselves may not always be useful for other groups or even for other members of the Syrian community. But keep in mind the timing of this project. It's fairly early in this community's resettlement process. They're still in very much a post-trauma context for themselves. And we know from experience with other communities that silence is often a coping mechanism, and sometimes it can contribute to barriers to accessing mental health and psychosocial supports identified in later years. So our project is suggesting that it is possible for groups to engage in dialogue regarding their psychosocial experiences and needs early in resettlement. And it's particularly important if led and run by members of the same community, and with the assistance of individuals like culture brokers who have knowledge of the systems to support linking to resources as these needs come up within the community.
Excellent. Thank you so much for sharing and noting that your work is incomplete, and yet so much solution, sort of community-led solution creation has come about, whether it's with youth groups, with senior groups, with many of the leaders of the small groups that were cultivated. I mean, it's really interesting to think about when we do research, it's not that one solution at the end, but that there's all of these other wonderful impacts that happen along the way. So thank you for sharing so much of that. As we get close to the Q&A, and thanks for all that's coming in, we want to hand over to Nosifo to build on this conversation around taking action and solving problems based upon research. And recognizing that both Dr. Sophie and Nosifo are in these places where they're moving through the research, which is why we wanted you to hear from them, not at the end product, but to hear about the journey and the tools that we can utilize that they're sharing. And so Nosifo, in your own work with sex workers in Durban, it seems as though it's resulted in new ways of intervening and promoting PrEP and HIV prevention among these women. And so I'm wondering if you can share a bit more about these solutions. What are they and how are they coming to creation?
Thank you, Dr. Zahira. So I think, first of all, one of the deliverables, or something that resulted from this co-creation, was a theory of change that that was informed by the solutions that were proposed by the peer educators to the challenges regarding PrEP uptake. And to come to have this theory of change, I mean, this involved meeting every week. We met together for a period of about 5 weeks, every Saturday for 5 weeks for about 3 hours, where we would look at each and every solution that each and every problem that was coming, that had emerged from the situational analysis phase. And you have this group of peer educators who are highly experienced, who are actually the ones that are driving PrEP promotion on the ground, looking at each and every challenge and proposing solutions. And what was important was just this dialogical space that was created for these peers, and these are peers that used to work separate from each other, but now they are coming together, united by this common purpose of actually promoting PrEP among peer educators. So this theory of change then resulted from those discussions. And then secondly, these peers put together an intervention program, which they titled Walk in Hope, because PrEP is a source of hope for sex workers. And this program, they designed it in such a way that it consists of a series of 8 workshops that foster personal and interpersonal engagement, because the concern amongst the peer educators was that the current PrEP intervention is biomedical in its approach. It's initiating sex workers on PrEP, giving them PrEP, and hoping that they will stay on PrEP. And so they felt that something was missing. They felt that we needed to couple this biomedical approach with an intervention that would address the behavioral and some of the structural challenges, that make engaging in PrEP difficult for sex workers. So the focus of the workshops would be to create a safe space for intentional dialogue where sex workers can express themselves through personal narratives. And really, each workshop has a major theme, with a series of personal and interpersonal activities, as well as questions to stimulate discussion. Some of the main themes that they came up with was hope. Hope was a very important theme because they felt like, because sex work in South Africa is criminalized and there's a lot of stigma and discrimination, it's important to try and foster a sense of hope amongst the sex work community. Another theme was power, power relations with partners, power relations amongst peers, with sex workers. So power was quite an important theme that they felt should form part of these discussions. Values and identity was another theme, because it's so, because sex work is stigmatized, it's almost like, the identity of a woman who is a sex worker, it just ends there, that she's just a sex worker. But the peers were saying, we are more than sex workers, we are mothers, we are sisters, we are friends, we are partners. And so it would be important then to actually, explore various parts of our identity. And in exploring these various parts of identity, this would foster a sense of understanding that you're not just a sex worker, but you are also a provider, you're also a mother, with the hopes that, this would also foster a sense of hope and a sense of self-appreciation amongst these women. And also another theme was agency and responsibility, that sex workers have the responsibility to protect themselves and protect others from HIV, but also that taking PrEP should be something that is informed by personal agency, and the need for personal autonomy as well. So, and then the last theme was positive action, to say, okay, when all is said and done, as a community, what is the action that we want to take, that is positive for us, for our partners, for our children, and for all the people in our lives. So these were the sort of, this was the sort of workshop that the peers proposed. And thirdly, what also resulted from this collaboration was in the form of PrEP awareness messages that were curated by the peer educators. So prior to this, there was a generic slogan for PrEP from the National Department of Health, which was, "We're the generation that will end HIV." And sex workers felt like they couldn't identify with that message. And they took it upon themselves. They said, okay, we want to come up with our own slogans about PrEP. And we want slogans that, they're not stigmatizing, but they inspire confidence, they inspire power and agency. So they went about coming up with these different slogans, which we printed on T-shirts. And these are the T-shirts that they wear when they go and do their PrEP outreach. And lastly, another important outcome from this process was this coherent collective approach to PrEP outreach that these two groups achieved. And it would be interesting because, there would be some of these suggestions that they would come up with within the group discussions. And after our sessions, when they go and do outreach, they would sort of apply some of these suggestions. And then the following week, they would come back and they'd say, oh my goodness, I actually tried this approach when I was talking about PrEP. And then I actually think it worked, and they'll be so excited because these are solutions that they've come up with, and they actually, attested to the fact that this was empowering. It was not just going out, doing outreach, using a script that you were given to say, this is what you need to say, but actually they came up with things that they were saying that they created, so it was such a very sort of collaborative and co-creative process, which got them really, really excited in promoting PrEP in a different way and in a way that resonated with them as peer educators.
Excellent, remarkable. Thank you so much, Nosifa. I mean, what you're really outlining that you use the term empowering, right? In this sense that you have power and control, and so important in research and so important, obviously, in our general lives. And so thank you so much for sharing a bit about your work and the way you all are moving towards action and problem solving. And there were a couple things that that you both shared that I felt were similar in the solution creation. So it seems like in both pieces of work, you have communities who are putting forward solutions that encourage relationship building. So in the group that's working in Durban, it seems like they're pitching these workshops and these opportunities to sort of build together. And as you said, move away from just the biomedical approach of public health to this other piece of around humanity that's really important in the work that we do. And it's such an amazing reminder for us in public health and medicine and nursing and pharmacy and sort of every field that we're in, that the pill isn't the only solution, that the injection isn't the only solution. Whatever it is that we feel like is coming forward as a biomedical solution, that we are humans and we're working with humans, and there's so much about our humanity that has to be part of our research and our practice. So grateful for you sharing these pieces of your journey thus far. I also want to note that what Nosifo is highlighting is her PhD research, which is also amazing and remarkable and really important for those of you on the student journey in thinking about how early in your career you can engage and bring in community-based participatory research into your work. And so thank you very much for sharing that. I think what we'd love to do now is begin to transition to the Q&A. And we have some amazing questions that have come through, all in the WhatsApp and also here in the Q&A chat. And so I think we'll want to transition to that immediately, and are so grateful thus far in hearing from Nosifo and Dr. Sophie in the expertise that they put forward. I'm also thankful to all of you who have shared in the Q&A thus far. You can keep those questions coming. What I will note is we're going to have about 30 minutes of Q&A in the remaining part of this session. But if your questions are not answered, our guests have also committed to answering those questions in writing. So when you receive an email at the end of this webinar, you will get the recorded video here. You'll get the video that Dr. Sophie mentioned. You'll get answers to the questions that didn't get answered in this conversation. And so we are delighted to be able to provide you with all of that information. You will also get, I forgot to mention, a reading list so that you can continue to grow in this area around CBPR and continue to learn and add this to the amazing work that I know all of you are doing as well. So thank you to our panelists. Thank you to those of you in attendance. And I'm gonna start with the questions we have thus far, but keep them coming. So Dr. Sophie, we have 2 questions for you, but let's get started with the first one. And this person says, how do you ensure that the community feels comfortable without feeling exploited in this type of research? And you can unmute yourself and share a little bit about your experience.
Yes, such an important question, because I think that what can happen with communities is this idea of being over-researched or being used in some ways for benefits that are not necessarily directly in service to their particular needs. And so recall that this project that we're engaged in right now sort of began with a sort of a concern or a question. And so I would say that I didn't necessarily say, oh, I have this idea and I would like you to come and can you help me kind of answer it because I'm curious about you in this particular way, or that I have a particular research kind of plan that I would like you to kind of contribute and help me develop in this way. What it came out of was a concern that was within the community and built on naturally in that way. So those people who are participating, who are involved, are also in some ways invested in the same idea, in that we want to get together, we want to have these conversations, and we want to that we find this to be meaningful in that way. So I think that the ongoing conversation is really important, the safety and trust that gets developed between the research team and the participants over time. In this case also, sometimes community-based research projects can have an advisory group that serve as an important kind of guide to kind of ensure that some of these things are not happening or people are getting exploited in some ways. In this case, because we have sort of our natural leaders, culture brokers sort of embedded within that, they serve as that advisory group in some ways, as well as they link to their groups and provide that information back and forth. And so I think that ongoing conversations are really important, responding to any concerns that come up. Also recognizing at times that we are bound by sometimes institutions that can actually have some barriers that we're having to kind of negotiate back and forth with. And I know that those can be some of the challenges that come up in community-based research, where communities may feel that we would like to do some things in a particular way, but our institutions are limiting us in this way. So I think the academics play an important role of playing a brokering role in trying to kind of negotiate and train sometimes our institutions to understand how communities work and why we need to work in the particular way that we do. So for example, I would say, Sophie had a lovely example there about the importance of food and how food can play a really important role in our conversations, because we are creating this dialogical space. Food and the kind of food that we eat to support that, nourishing, warm food while we're talking about difficult conversations can be really important. In my case, I had to negotiate back with my institution why warm food that is from the community, catered by community members, is so critical, rather than the standard maybe procedures that the university might have in terms of who our standard caterers are, who we provide food with. Sandwiches and lettuce are not going to work. We need warm food that is relevant to the community and culture, because they were having difficult conversations. They need to take a break, eat together, rest, relax, and come back into the space. So those are some of the examples in which we sometimes are needing to actually respond.
Great, thank you so much. Amazing, wonderful to highlight everything from the small things like food all the way to the science, and so grateful for that. Maybe a question for Nosifo. Someone asked if sex work is criminalized in South Africa, and I think you mentioned that it is. And they asked, what are the best approaches for working with vulnerable communities in countries where stigma is rampant? And so what are some of the ways that you partner with a community around an issue that may be part of why they're stigmatized?
That's a very good question. And I think, the issue of stigma is still such a big challenge, even up to now. And I mean, I found that, the fact, working with sex workers, they are highly stigmatized, criminalized. The best way is to actually hear from them, as to how can we go about working together? What is it that, would ensure that you are safe, that you are comfortable? Where can we meet? And how do we do that? Because, it's so easy to come in and say, this is the idea that I have, and this is where we are, this is where our offices are situated, and things like that, but if you don't then take into consideration that, but if you're working with this group of people, safety is important for them. And if they are stigmatized, then there are certain areas, for example, that they would probably avoid because of the fact that, they experience so much stigma. So it's important to hear from them, ask them, speak, have this conversation and this dialogue to say, but what would work for this group, for you guys? What is it that we can do together that would ensure that you feel comfortable in this process? So it's important to just let the people inform the process.
Excellent. Thank you. Thank you. That is wonderful. We have some other really great questions that have come in, and you can keep them coming. And as I said, our guests will answer them in writing if we don't get to them this evening. But there was a question here about what challenges in engagement with peer educators or cultural brokers did researchers have to navigate? So in partnering with these two groups, peer educators and cultural brokers, what challenges in engagement did you encounter? And this is for both of you. And perhaps we can begin with Sophie and then Nosifo.
I think I'm going to start by actually building off exactly from what Nosifo was talking about stigma. And recall that our project actually is centered around a potentially stigmatizing kind of topic, which is sort of mental health, addressing mental health concerns or well-being concerns in the aftermath of experiences of war and mass violence. And so initially, I think part of the project itself was actually around how can we actually find ways of addressing this in a way that is safe, that is honoring and supports people's dignity. At the same time, making sure that that this particular concern that was raised around, are people able to access supports, and are they able to feel that the sources of some of the challenges they're experiencing are addressed. So I would say that perhaps with engagement with in my case, the natural leaders and the cultural brokers were really language issues, because again, they're Arabic speaking. As a researcher, I'm African, I speak Swahili, I don't speak Arabic, although I can hear and understand Arabic. I can hear Arabic, but I can't speak it. And so it's really, what I think was important was developing that shared language or way of kind of communicating even amongst us. What was really important, I also want to say, is that we're also working with the community who are brand new in the country and learning the environment as we are working together. So those 2 years, particularly with the second mental health training project, was really helpful, because some of the leaders who were involved in that continued in the current project with us. And what was really interesting was also just how quickly they were learning English. And I would say initially we needed translators, and the culture brokers would provide that translation. But as time went by, they're like, no, I can speak for myself. I don't need to. And it's been really wonderful to actually see, because of the time that we've been engaged together, that actually language has become sort of less of a barrier, particularly with the core people that we are working with. But I think that that is something that is really important for us to constantly consider. And also for me, I would say that as a researcher doing cross-cultural work, being very mindful of cultural differences and being very careful to attend to those cultural protocols within the community, and really reflecting on my positionality as a researcher. So reflecting as I go in, how do I enter into these groups? Sometimes where it might be a space that typically, let's say a female researcher might not always be allowed into, and how I do that with care and with the right protocols that I need to be aware of. Paying attention to, for example, issues of gender, paying attention for issues of religion have been really important. So I think those are some of the things that just being aware of, reflecting on, and being mindful has been really important in the process.
Excellent, brilliant. Thank you, thank you. And thanks for these questions. There's some good questions coming in. And another one that's highlighted here, and I might build upon this a little bit, is this person asked for both of you, how can you implement a participatory approach while navigating the inflexibility of projects or program goals? And I might add to this, while navigating the inflexibility of funding and funding limitations or funding cycles, but participatory approaches seem to require so much additional time and energy and investment and flexibility. So how do you manage that with perhaps the inflexibility of your donors or others? And maybe starting with Nosifo.
Yes, that's like one of the hard questions, you know, when it comes to participatory research. And I think having then to manage the expectations of your donors, as well as the reality on the ground. And I think, you know, this is something that I've also, in a way, had to think about, and this is some of the things that conversations that I have with my students, because as health promoters as well, we're very focused on working with communities, creating enabling environments. But then at the same time, it's what happens, when you have strict timelines and your donors expecting data and things like that. How can you manage that? And I mean, through some of the readings that we've done, there's this process that is called, parallel tracking, where it's the top-down approach and the bottom-up approach, and how as a program manager, you can try to then use both approaches, in the sense that, yes, you have your program deliverables, you have your aims and objectives, but then in your conversation with community members, the way in which you come in, you do your community entry, you do your engagement, you then say that, we understand that as a community, maybe these are your pressing issues. However, as a project, this is the sort of work that we would like to do with you, and then sort of take it from there. But it's been very, it's sort of being careful in how you enter, to say, you understand that, there are problems here, there are competing interests. Basically, you may come with a health problem or program, but the community is saying, we need jobs, there's unemployment, this is our priority here. And so then it's then having to navigate that carefully, to say, yes, you recognize that there are priorities that community members have. However, this is another challenge at the same time. And then how do we work together then to manage that? So it's that top-down, bottom-up approach, and then it's that parallel tracking, to say, even in your program objectives, how do you bring in that aspect of empowerment, of community voice? So it's sort of having to merge those two approaches together to sort of come with a workable solution. But it's very difficult. It's very difficult.
Yes, yes. Well, thank you so much for helping us think a little bit about how we manage both donors and also partnering with communities. Maybe Dr. Sophie, you'd like to build on this a little bit.
Yeah, I think Nasifa answered that really well. It's true. It's sort of an ongoing negotiation. I would also add that in the same way that CBPR sort of has this goal of social change at the community level, there's also this parallel process that I think that has happened with the community of participatory researchers and community-based researchers, in also trying to perhaps slowly change the systems or the institutions that we work with. And so the more we do this kind of work, I think the institutions are also adapting and slowly recognizing that there are different types of work that need to be recognized. And I would like to also say that the more that that work is kind of moving away from perhaps mainstream sort of ways of practice, there's always going to be those people sort of who lead that, and that helps to kind of shift ways. And I think that's also been important for donors to kind of be educated over time. And so as I think that more of us, as we are reporting on the work that we do, to actually also identify what were the kind of barriers that were brought up perhaps by institutions. It is a lot of work though, and I think that might be, we'll talk about perhaps some of the challenges or recognizing the limitations perhaps of this type of work, and that there is that investment in community, but it may also require more work in that you're spending time also navigating educational kind of components with the systems that we're in. When it comes to the community, you can see at the beginning, I talked about spending time at the beginning, developing the team and doing some training around research and training about CBPR. And I think that's really important, because frequently we come back in our discussions as to what is the research and what are some of the potential kind of guidelines in which we're following as part of the research. Because from time to time, as Nosifo mentioned, you will have somebody who will say, why can't we have action right away? This is taking such a long time. And then sort of, I think that piece around educating around how research processes can take time. The journey towards policy change is a slow one. And that sometimes when you're invested in working with a community over time, you can look back and see where the changes have taken place. And so I think that's really important as well. Some of the things, for example, that we've had to, as I mentioned earlier, had to negotiate with, for example, institutions, is recognizing that there are particular barriers that certain communities may have that haven't allowed them to participate in research, and oftentimes marginalized and silenced because of that. So for example, transportation, childcare costs. And so over time, having funders who recognize that embedding the importance of actually childcare and transportation and food and honorariums that can help to contribute to the missing work that people experience because of participating, for example, in these groups, is really important. And so that, I think, has been a slow process of change over time in which we are really finding that. And I would say with the current project that I have, I'm really grateful for the fact that some of those have been embedded and that they were able to be honored. And so again, like I said, some of that is an ongoing negotiation. Yeah.
Excellent, excellent. Thank you so much. And thanks for highlighting, I think, how you push back a little bit on the system of research, or sort of the way in which donors give. Because I think it is true that as we do more and more CBPR research, that we have to reflect back to the places where we apply for funds to say, this is how the money really needs to be spent. And that may be different than the way you outlined. And these are the things you might have to spend on, and that may be different than what you thought as a donor in the beginning. So thank you for highlighting how we have to also engage in this powered conversation with donors. That's great to hear. We have just about maybe 7 minutes left of Q&A before we start to wrap up a little bit with our closing remarks from our panelists and a few housekeeping items. And so I wanted to maybe hand over to a question that came from the chat around kind of the tension that may exist between academics and others. And so this person asks, have there been moments where your role as an academic or a scholar has come into tension with your commitment to power sharing or your commitment to co-creation? Could you describe one of those moments if that exists? And what guidance would you give a researcher to deal with any tensions that may arise between your role as an academic and your commitment to power sharing? And maybe, I know that's actually a really good question and maybe a tricky one, so I'll give you both a moment to consider. And then perhaps we'll begin with Nosifo and then move to Sophie.
Thank you. Yes, that's a very good question. And I think, yeah, for me, working with sex workers, there was a moment in the process where, one of the ladies brought up a really big issue where she said that, researchers come in here, they do research and then they leave and we never hear from them again. And the question to me was, are you going to do that? Are you just here to get what you want and leave? And, it was after an incident that happened where, yes, one researcher came in, she did what she needed to do and she left. And so, I then found myself in a bit of a pickle there because now I was also being asked the same question. And, it was important for me to really, build trust and to then say, I'm just not here to just extract and go, and really making sure that I live up to that, that even though it's been 3 years into my PhD, I still make sure that whatever, events are happening, meetings that are happening, I'm there, and I mean, as a result, there's an organization that it's an initiative that one of the ladies started, which is known as Mothers for the Future. And basically it's targeting children of sex workers, and so it was an honor and a privilege that I actually was named a friend of Mothers for the Future. So I'm there to provide research capacity and just advise and any other sort of workshops that they'd like me to run. So this is a lifelong commitment. at the end of the day. And I'm just happy to offer my services and just be there. And at the end of the day, you know, now there's actually this blur as to whether I'm a researcher or am I a friend? And I feel more of a friend than a researcher now. So, but, you know, that was something that I had to manage, that, you know, yes, they have felt exploited in the past and used, and, you know, and so as a researcher, then I had to manage that process and do something different. So that was a challenge, but I was happy that, you know, they actually put me down and asked me that question and were very frank with me as to what they expect.
Excellent, excellent. Dr. Sophie.
Yes, I think that's a really important question about power sharing, and fact that the status of being an academic or coming from academia has its own sort of power that goes with that. I would say that my approach has always been a very sort of relational approach, and I think that that has served well over time, in that those recognizing that relationships of trust take time. And it's an investment in community generally. So outside of even just maybe this particular project I've been talking about here, I've been involved in various community-based projects in my city where I live here for over 20 years. And so I think that that perhaps even just being, perhaps that helps in many ways as well, because at times you may be conducting a research project, but at times you're doing something else. So as Nosifo said, you may be invited to help in other capacities, for example, doing some training. Remember that my entry into working with Syrians began with an invitation from a community organization to simply support them to prepare their 8 Arabic-speaking brokers, to prepare them to start working with Syrians. So the relationship had began even before Syrians perhaps had come, in that we were starting to kind of think about how to actually support this community as they come in. And my area of expertise around mental health, trauma and resilience informed practices was really important in supporting that. I also think that really recognizing that at times there will be tensions, and being willing to kind of walk through that together rather than shutting it down by using your power, like, well, I'm an academic, hiding behind that and say, well, this is the way we practice. And I think sometimes we can hide behind that and perhaps use that power in some ways, but I think that this is not the place for that type of behavior, I would say. And work, it really is often a place of at times asking, you know, apologizing or saying this didn't work out the same way, and negotiating perhaps some of those changes. I will say one of the sort of areas that I've experienced that bumped up with a Syrian project recently was, we were just about to kind of distribute gift certificates for honorariums to our participants when COVID kind of happened. And one of the barriers we've had is that we do require people to have signatures. And signatures are, you see in work that documents that somebody has actually received their let's say their honorarium and that. And so we experience a delay in this as we've tried to kind of figure out ways of actually delivering these through no contact. And this has not been right, and kind of how we've been, that was delayed. And so I would say that I've actually had to receive grace from our partners in trying to kind of navigate between how the system, the university processes require these signatures, and at the same time navigating with the barrier to actually meet people face to face, because we're currently not allowed to have any sort of direct contact with our participants. And so being really open about just how this is not right, but also it's been something that we're trying to kind of work through, and we've figured it out right now and actually are working it through. But I think that to be mindful of not hiding behind power, and to use power in the right way. I would say the right use of power is really important in this case. Thanks.
Excellent. Thank you so much, Dr. Sophie. Thank you, Nosifo. I love that comment of not to hide behind your power, but also to use your power in the right way, in research, in answering difficult questions, in partnering with communities that may be experiencing stigma or may be feeling marginalized in other ways. And so really grateful for your engagement in this Q&A. And I think there's one final question from this group. They had many, and so as I said to all who are listening and viewing, we will answer the other questions in writing, and you'll receive kind of a summary email from us. And partially that's to give you extra information, readings, answers to the questions, a recording of this conversation, the video that Dr. Sophie shared about her work, but also so that we can keep this conversation going and keep this relationship going, because we hope to see you in the next Department of Community Health and Social Medicine webinar and continue to build on these kinds of discussions. So the final question that I'm taking from the chat, I think, is actually a good closing one. And so this person asks, at the end of these projects, as you move on after implementation, what will happen to these communities, or what are you hoping will happen to the communities that you've partnered with thus far? And I think I'll hand over to Sophie and then to Nosifo. So feel free to unmute when you're ready.
I have many hopes for the community that I'm working with for this particular project, but I think more importantly is the hopes that they have themselves, rather than, that's what's really important. My hope, though, I would mention is perhaps that by participating in these dialogue groups, that those members of the communities will have had an experience of actually recognizing that in a safe place, one can actually share and talk about important experiences that perhaps there might not be other spaces to actually share those. And that recognizing also that through dialogue, people actually do come up with ideas and solutions and recommendations, and that perhaps that they would continue to kind of engage civically in their communities in the same way. My hope is that the leaders, or the natural leaders that we work with, continue to find that the value that they learn, continue to use the knowledge that they gained from their own community members and use that in the work that they do moving forward. And my hope is that we will actually continue to be in contact in one way or another. As you can see, that this was a series of projects, and so it might continue to work. We might continue to work in one way or another, and that's definitely how it's been with other communities over the years that I've worked with. That doesn't always necessarily end with a project and you move on to another. That you still maintain contact.
Excellent, thank you. Nosifo.
Yes, thank you. I think for me and for the ladies that I've been working with, I think the big thing, it's sustainability is always a big, it's the big question when it comes to community work and engagement and interventions. And I think, placing this intervention in the hands of the peer educators, I think for me, that was really, really important for them to feel a sense of confidence and a sense of ownership, and to know that, nothing about us without us, the solution lies with us. And I feel like because this intervention is designed in such that it's implemented by sex workers for sex workers, the hope is then when we move to the next phase, which is implementation, that, we're going to then run these workshops, and in running these workshops, train other sex workers who are not necessarily peer educators, but are really interested in helping others in the process of HIV prevention, really sort of take this forward, teach one, reach others, approach that we have with this intervention. And I think really just fostering a sense of leadership amongst the sex work community, for them to know that, to actually design interventions and implement them is something that we are very much capable of. And I hoping that, this is something that we could really take up as researchers as well, to know that, it doesn't mean that when you are working with a marginalized group that they necessarily don't know what's good for them or what works for them. So my hope is that this sort of approach to ensuring that, you know, the sex workers are the ones who design programs and implement programs, that we can carry that forward. But my work with sex workers in Durban continues. I am a friend of Mothers for the Future, so there's lots of research that they'd like us to work on. There's funding that we need to get. So there's just so much work on the ground that, you know, I mean, there's just, the journey continues, and it will go forward from here. So yes, thank you.
Excellent. Thank you, Nosifo. Thank you, Dr. Sophie. Thank you to the person who asked that final question. I think it helped to really wrap up our conversation. Thank you all for listening in and focusing on community-based participatory research with us for 90 minutes. We know you could be doing many other things on a day like today, and we're grateful for your time and your energy and your effort. Thank you so much again to our panelists, to Dr. Sophie and to Nosifo, soon to be Dr. Nosifo. So I feel like I keep stumbling over it because I just want to say Dr. Nosifo, and soon to be, and wonderful and excited to hear about that journey as well. Up on your screen, you'll see all the different ways that you can get in contact with us at UGHE, as well as with the Department of Community Health and Social Medicine. We are grateful for your time, your energy, your activism, your research skill, and your willingness to want to engage communities in ways that encourage equity and encourage changes in power imbalances that have existed for such a long time. Asanteni sana. Thank you very much. Murakoze chane. We hope that you have a wonderful morning, afternoon, evening, wherever you are in the world. Thank you, and we'll see you next time.